India's under 5 child mortality rate is 39.4 deaths per 1,000 live births, which now matches the average for the world. Although India has been catching up, infant death rates have been declining. 73% of children under the age of 5 are affected with pneumonia. Only 72% of births of children under the age of 5 are registered or reported. Numbers aren't even as accurate due to the large number of unreported births. 22% of women who gave birth are before the age of 18. Moreover, unfortunately, there are nearly 21 million Indian girls that are unwanted by their families. 40 deaths per 1,000 live births for females in India.
There's a widening gap between the rich and the poor in India, as the rich keep getting richer. For example, India's best-off state, Goa, is compared to Bulgaria in terms of GDP PVP per capita, which is ranked at about 60 according to the IMF, and that's just over $23,000. Comparatively, India's worst-off state, Uttar Pradesh, is compared to Guinea in terms of GDP PVP per capita, which is ranked at 171, and that figure is just below $2,000. So it's clear that there is diversity within India. One of India's other richest states, Maharashtra, is home to Mumbai, and Mumbai is a very well-off and rich city, but it also is home to the second biggest slum in Asia. So there's some wide-ranging diversity in India. And India is worse off overall because of its size and independent governments and culture. The governments in between states and territories don't really work together. So the poorest states just stay in their poor state, and the rich states are doing their own thing. And therefore, poorer states have less access to public and private hospitals, and you could say that they have worse health care overall. And the lack of education in the poorest states does not help. So that is part of the reason why poorer states are falling behind, and something needs to be done about that immediately.
Currently, the top 1% of the population in India has 73% of the country's wealth. Also, the top 1% evaded $200 billion in taxes, which is money that could be spent to improve public health. With India's outrageous gap in wealth, it would take 941 years for a rural minimum wage worker to earn the pay of an executive in India. The bottom 40% of the population, in terms of wealth, owns 3.4% of total assets in India. Government projects and programs promoting inclusive growth, higher tax on the super rich, policies to eliminate gender discrimination could be beneficial to make it harder to evade taxes in India.